Go.
Okay. There's many ways that you can control this fiber. You don't want it to get all over the place. I find just wrapping up a little piece of tape. There is a wheel that's included with this. I do not use it. I find just by holding this, it doesn't get in the way. It's easy movement. A little bit later I'm going to show you how to set this entirely up. So after you've stripped it, you just take this and you put it in and you feed it through here. And there's going to be a wheel on the other side of it. And if it's a little stuck, you just feed it back and forth. Make sure that's tight right there. Make sure the wheel's moving. And just slowly feed it. If it's a little stuck, you just push it. Why it's doing this. There we go. And you see you go all the way through. Now you can see it going through. And you just pull it back. You could leave this out. If you wanted to, you could leave it like this and you're done. But you notice it's a little hard to use. I want to bring this back to about right here. And it's whatever your comfort level is. That you can roll it forward. I highly recommend when you're done with it that it's like a turtle. You put the head inside and then you bring it out. And I'll do this, about like that. Now, the technique is this. You always go 90 degrees to the nail. Okay, now the first thing I'll do is I have it on, and it's not on right now, but I'm going to show you the beam. You see the beam? Can you see the beam? Okay, so you put it in here, and here's the beam. And you just slowly, I'm going to be a millimeter away. I'm slowly going here. I'm not going to feel any heat because I do not have the laser on. This is the beam. And I just go back and forth, and you slowly do the speed until the patient feels slight warmth. Ask the patient, how's it feel? When you feel slight warmth, you're doing fine. You just paint it on like this. Paint it on like this. Okay, now the next thing you're going to do is you're actually going to put, I'm not going to put it in contact. Let's see. Yeah, I'll actually scrape it now. And I have the videos of this. You just do this. Now the laser, the actual cutting beam is not on. You go 90 degrees and you just scrape it. It will turn brown. You can actually put little marks in it. So it's a combination first putting little marks in it. You can just do it this way, a millimeter off. Or you can scrape it down, scrape it through, or sweeping is what we call it. And they will get a little bit of smoke because it's actually denaturizing the nail as you apply it. And this is really, you should practice this on your own fingernails. This is the movement, just like that. You follow the beam and not the fiber. And then you shut it off. What's really nice about this is you go into standby and it'll go off. Still on. Upper right hand corner is the battery. These batteries are charged. We have two batteries that come with this unit. They're charged on a Lion charger, so you always have one charger working. So you can switch from charger to charger. If you want to, you can go AC right into the wall. I use the chargers. I can do this nail surgery all day long charging. Now how often do you do this? You'll do this once, in 2 weeks you do another one, then you wait 8 weeks. If you want to, you can do another one. You can do as many as you want. I do one and then 30 days apart. Some doctors will go 1, 4, 6, 12. You can do that. It's only a minute a nail. It's not a long procedure. Now the advantage of this over most wavelengths is that you'll actually see almost immediate changes in the nail because it's denaturizing it, and it's also going right through treating the nail bed. In the future I will show you some of our infrared cameras showing the depth of penetration with this. This to me has a tremendous amount of potential, this laser, because you can treat surgical warts, you can cut out surgical benign lesions, you can then adjust the power to treating warts, and it has a whole other side called physical therapy, which we'll talk about shortly. Thank you.